Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Good evening and welcome everyone to Heart of Health Live, and we hope you're having just a great day today. We're going to be talking about a very interesting topic tonight. That's diabetes, amongst other things. We have board internist Dr. Carlton Vollberg with us here today. He's been practicing for years. He can answer your questions. He's not going to charge you anything. You won't see any bills. So if you happen to be flipping through and watching the news and don't want to hear about all the bad stuff that's been happening in the world, want to do something to improve your health, give us a call. Our number here is 855-644-3278. That's 855-644-3278. We're glad you join us. And you know, when we think about all the healthcare problems we have in this world, where, you know, about 20% of our money that we spend now in our country is now on healthcare. We see what a large part that is playing in government and regulations. You know, we can't legislate good health, but each individual can be responsible. You can get yourself healthier, you can get yourself sick. We're here to help you learn how to do these things. And tonight, we're here with board-certified internist Dr. Carlton Vollberg. We're going to specifically be talking about diabetes. A lot of other questions are going to be answered. Did you realize now that I read some statistics, and Dr. Vollberg can verify that up to 90% of all diabetes might be reversible. That's called type 2 diabetes. We're going to learn tonight what type 2 diabetes is, what type 1 diabetes is. We're also going to be learning if you have diabetes, it's something to take very seriously because it can damage your organs, like it can hurt your eyes, your kidneys, your heart. It can hurt your other organs. Some people even get so bad in their extremities that they even have to have amputations. So diabetes is a problem to be taken seriously. And sometimes, like high blood pressure, heart failure, arthritis, diabetes, these chronic diseases, if treated and detected early, you can prevent lots of problems in the future years. So we're going to be talking about diabetes tonight. We're with Dr. Carlton Vollberg. We want you to give us a call. Our phone number is 855-644-3278. So go grab a drink, go to the bathroom. You know, you don't have to watch the news. We want to stay here right with us on Heart of Health Live. Don't go away, because after this short break, we're going to be right back and introduce you to Dr. Carlton Vollberg.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I'm glad you stayed with us over that break. I'm Dr. James Marcum. I'm here with Dr. Carlton Vollberg. And Carlton, welcome to Heart of Health Live.
Thank you. It's good to be here.
I bet you had to work today, huh?
I did.
Okay. You saw a lot of patients, and I bet you a couple of these might have had diabetes.
I did. I definitely saw some patients with diabetes. We, in my practice, as a general internist, will do wellness exams, physicals, but we also take care of hypertension, diabetes, heart disease, the gamut. And so diabetes is a very common problem, increasingly so, unfortunately.
You know, one of the things that I predict, in healthcare, 200 years ago, if you didn't put leeches on patients, you were a bad doctor.
Right.
As early as the 30s, if you didn't prescribe smoking to people with asthma, you were going to be called a bad doctor.
Right.
And I look at all the chronic diseases that we just throw medicines at.
Right.
And 200 years from now, if we're all here, they're going to say, what were these guys thinking?
That's right. That's
you know? And that's what we want to let people know. There's a place for medicine. There's a place for lifestyle in changing our body's chemistry. Let's just jump into our questions. You ready for some questions?
Absolutely.
Okay. And our audience, these have come in from all over. So if you want to give us a call, you can ask your question at 855-644-3278. Or you can go to our website. That's heartwiseministry.org. Or you can send them into Facebook. That's heartwiseministries.org. Our first question. My doctor told me I have diabetes, and yet I feel fine. I'm 45 and overweight. Shouldn't I feel something if I have diabetes? So should a person with diabetes necessarily have a symptom?
Not necessarily. I mean, diabetes is one of those things that until it gets way out of control, you may not have many symptoms.
Okay.
When the sugar starts getting up really high, you may have increased thirst, increased urination, some of those symptoms. But until the sugar gets up to a more critical level, you may not have very many symptoms. And so it's important to go in and get checked every year and to have a physical and get some routine blood work to see what your sugar is.
Okay.
I mean, there are people running around with a sugar of 110 or 115 and they don't have any symptoms, but that's clearly too high. And so, one of the things that we do in our office is every year we do a complete fasting set of lab work to make sure that all the parameters are where they should be.
Okay. Now, I guess at 45, that would be a type 2, okay?
More than likely.
What about a type 1? Let's talk about what is a type 1 and type 2, and should there be any differences?
Yeah, type 1s, and we do see some in an adult practice like I have. I do have some type 1 diabetics that usually, since I see patients that are older than the age of 18, they've already been previously diagnosed by the time they get to me, because type 1 diabetes usually, hits people when they're much younger, in their teens or even earlier. And so, and when those patients present, they usually present, they're very sick because their blood sugars are 400 or 500, they're dehydrated, they're losing weight, and they're critically ill. And so the diagnosis is made very quickly. Whereas type 2 diabetes comes on more gradual over time, and it's usually associated with weight gain, dietary issues. So if you catch those types of patients when they're dysmetabolic or when they're pre-diabetic, so to speak, if you want to use that word, I don't know that it's fully recognized, but somebody that's sort of in that nebulous zone, that they're not quite a diabetic, if you want to catch those people early and get them trained, sometimes they can actually prevent themselves from turning into a diabetic down the road. So it would be important, even at 45, and even if you're not feeling badly, to know what your sugar is and how you can get that down.
Right. Now, I've heard that, type 1, the different types of diabetes, we have gestational, diabetes insipidus, but I heard that type 2, which most people have,
Right.
I heard that's mainly could be related to the way people live, lifestyle.
It is. I mean, there are a couple of things in the Western diet. This is mostly a Western disease. If you look around the world, some of the Asian countries where they don't eat the sugars, the refined processed foods that we do, they have much lower rates of diabetes. And so if you can make an impact early on with nutrition, and you can teach people to exercise, to keep their weight down, more importantly, to stay away from soft drinks. Soft drinks are the worst thing that anybody can do.
Okay.
The high fructose corn syrup, which is in everything. It's in cereals, it's in candy, it's in lots of things that we eat. And I know that many companies nutritionally are trying to get high fructose corn syrup out. It's still there. And so if we can impact people by changing lifestyle, we can prevent these diseases down the road.
Well, that's great. Well, I hope that answered your question. So I guess the question is, you might not feel anything if you have diabetes, so get it screened early. Good preventive care. So you might be able to prevent this from progressing into full-blown diabetes. We're going to have a question that comes up about hemoglobin A1C after this break, and we want you to give us a call at 855-644-3278. Don't go away.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Nice. No. Come on. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. I'm Dr. James Marcum here with board-certified internist Dr. Carlton Vollberg. And before we talk about A1C, we have some questions that have come in. And our first question or comment comes from Indiana, from Tuckmore. Tuckmore, you're on Heart of Health Live. What's your question or comment for Dr. Vollberg? Mr. Tuckmore? Tuckmore, I got you there? You're on live. What's your question for Dr.
Is there a medication or drug that you see on TV that try to...
Okay. Is there a medication that does what? I think I missed it
For
there.
diet. For diet, you know, they got these, they have these shows that you say take this pill and you lose 50 pounds or 100 pounds, but is there a medication that you can take that affects the diabetes, you know, where the diabetic?
A medicine that'll help you lose weight.
Yeah, thank you for your question, and that's a good one. There are medications out that can help people to lose weight. There are some older drugs out. Phentermine, it's a stimulant that's been out for years. Before that, it was fenfluramine, which was removed from the market because of supposed heart valve defects. The problem with drugs is that it doesn't address the long-term issues. You can't stay on a pill or a stimulant to keep your weight down. There's some newer drugs that are coming out. One is a combination of phentermine and Topamax, and that is, it just now has come out. But again, it's the same thing. I mean, you're going to take this drug and conceivably you'll lose some weight while you take it, but then what happens once you come off the drug? So really what we try to do is encourage more of a lifestyle change, and it's the thinking process, the way you look at food, the way you address your portion size, and that sort of thing. And where appropriate, medications are something to consider, but then you have to look at other parameters too. What other drugs will somebody be taking? And so you want to make sure that obviously that you go through a doctor that understands your needs, that looks at your medications, and that you get the proper treatment. And it needs to be a lifestyle. It needs to be a global process that you're looking at.
Tuckmore, what have you tried so far?
Oh, I see it on TV where they have, you know, a miracle pill that you take, and I have questioned my doctor, but he hadn't really gave me anything to concern, you know, specifically.
Do you have a specific name for this product?
No, it's like they takes all the fat. Supposed to take the fat out of your
Fat
food
burners.
before you get to it.
Yeah, you know, unfortunately, there are many, I don't want to use the term scams, but there are many people touting big claims for certain products to lose massive amounts of weight. And what I would say with that is, if it's too good to be true, it almost always is. You need to follow the trail behind it. And I would just encourage you in this situation to make sure that you take all these questions back to your doctor. If you have a supplement that you want to try that you're not sure about, ask your doctor to research it for you. I have patients that come to me and say, what about this herbal product? I've heard that it'll help me to lose a lot of weight, but I don't know anything about it. And if I don't know anything about it, I'll go and do a little bit of research. Unfortunately, more times than not, it's just people saying, I've tried this, I've lost some weight. If you try it, you'll lose weight too. And that really just, that isn't a good way to operate. You need things that are proven. And the other thing that's real big right now is HCG. People are doing these HCG injections.
Tell us about that.
Well, you know, that's something that really I haven't gotten into in my practice. I really don't think it's a good idea. I've got patients that come in, and many of them do lose weight doing it. They seem to gain it all back as soon as they stop. And you can take sublingual drops, you can do injections. We don't know anything about the safety behind this, so I consider it, you know, not a great way to lose weight. I still think your best approach is through good, sound nutrition.
And remember, Tuckmore, Rome wasn't built in a day. So just pick one thing and stick with it, whether it's a simple exercise program or building on it, or not eating big at night, or getting rid of soft drinks, or drinking more water, or eating the fiber first, little things. But you know, I'm a cardiologist, and every different medicine that they used to have for weight loss, you know, we have Fen-Phen, that's off the market. Several other ones have been removed from the market. They aren't really a long-term solution, and most of the things that I see out there that increase the metabolism are dangerous to other organ systems, so they're not a long-term fix.
That's right, and what really increases your metabolism is getting a little bit of exercise.
There you go.
So if you can get out and get some exercise, that really, really helps.
Well, they all advertise a miracle drug.
Yeah, well, I don't think there's
You
a
know, like if you take this pill and you drop 50 pounds, but they ain't saying there's a side effects.
That's right.
And with my sugar, that's what I was afraid of.
Well, thank you for your call. We're going to have to go to break. And after we go to break, we're going to have Davey. Davey, stay with us. We're going to be back to you after break. Davey from Michigan's calling. We're going to be back to you on Heart of Health Live.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com. Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, everyone. I'm with board-certified internist Dr. Carlton Vollberg. And you know what, Dr. Vollberg? I don't have diabetes, but my eyes aren't working so good because I was looking at the monitor and it's Daisy, not Davy. It's Daisy. Daisy, you're on with Carlton Vollberg. What's your question or comment? I'm sorry I messed up your name earlier.
Okay. Well, some of my questions have already been answered. I was going to ask, my daughter had a fasting test done ×2 in her teens. She's 19 now. She was having pre-diabetes symptoms such as dark skin on the back of her neck and under her arms, so I took her in for the testing. And each time that she did the fasting test, it came back that she did not have diabetes.
Yeah, that's interesting. And, you know, maybe it is that she's pretty young still. She just might be hyperinsulinemic. You know, is she heavy?
Yes, she is overweight.
Okay. So this may be, like you said, maybe more of a so-called pre-diabetic state that down the road she may be looking at some higher blood sugar levels. They just haven't gone up yet, but she's got the physical manifestations that these high insulin levels are creating. And I think that's probably reflected in the normal fasting readings that you're talking about.
What can she do now to help maybe prevent diabetes?
You know, the best thing that she can do is get her weight down, make sure that she gets on a good, solid nutritional program, eating the right kind of foods, avoiding the sweets, the high fructose corn syrups, the high fat foods, more fruits and vegetables, those sorts of things.
Yeah, I'm just so glad she had it checked.
Right, yeah. Many people aren't getting checked, and that's a problem because then they don't know what they're having until they're 45 or 50 years old, and they come in and they've got a very high blood sugar. So the fact that she's 19 years old and she's getting, you know, having this checked now is a positive thing. If you can catch somebody before they get too old, you can make changes. And if you make changes now, that's going to prevent them from having problems down the road. So this is just the perfect time for her to get with a good doctor, a lifestyle-minded doctor, and to get these changes made so she can avoid a diagnosis of diabetes, because then once you have that, then the other diseases follow along, the heart disease, the hypertension, they all run together.
Okay, thank you.
Daisy, thank you for your
Thank
call.
you.
Okay. You know, Dr. Vollberg, you know, I've heard some specialists say that type 2 diabetes is a disease of fat.
Right.
Too much fat in our American diet or wherever, and too much fat on the body. And if we can eliminate a lot of the fat in our diet and a lot of the fat on the body, we can cure this disease.
Well, absolutely. I mean, I think that, and it's happening. I mean, it's happening now because there's more recognition in the pathophysiology behind diabetes. And I think if people will make the commitment, and it requires change, and people don't like change, but you have to decide, what do you want to do? Do you want to take a handful of pills or a fistful of pills, or do you want to try and get out and get some exercise, lose some weight, and eat a better diet? And until we as Americans decide that we're going to embrace lifestyle changes, we're going to continue to have epidemics with diabetes, and we're going to make drug companies really, really happy.
Yeah.
For some people, it's just easier to take 4 or 5 drugs to get their blood sugar down. I personally think it's much better if you can make the changes, lose the weight, do your exercise, and then try and avoid those medications. Not everybody can avoid them. I mean, let me be clear about that. I'm not telling those diabetics that are listening to go drop their medications. But what I am saying is, if you've got a physician that's willing to actually sit and listen to you and help you with the nutrition and the exercise, you probably can avoid some of those medications or even come off some of them.
I think that's good advice. You know, our phone lines are lit up. It's 855-644-3278. And if the line happens to be full, you'll get a message. You can always leave your message. We'd answer it. Or you can go to our website at heartwiseministries.org. After the break, we are going to talk to Ruth after this break. But before we go to break, Dr. Vollberg, have you ever seen a medicine cure type 2 diabetes?
Yeah, you know, it's an interesting question. There are some medications out there that sort of help with the diabetes and maybe even help the beta cell function, but nothing that cures the disease at this point.
Now, would you be willing, if a patient came to you and made the diagnosis of type 2 diabetes, would you be willing to give them a trial of diet and exercise for 3 or 4 months before you threw them on a medicine?
Absolutely. If their sugars were reasonable, I would absolutely consider doing that.
And I guess you put them on medicines with the hope of if they can change their lifestyle, then they can pull off the medicine.
And I can tell you about a patient after the break that did just that.
Well, that's fantastic. Well, we want you to join in our conversation. We're hoping you're learning something. Turn off the news, watch us here, learn about diabetes. As you can see, lots of people have it. It's something we all need to learn about because we don't want to be a casualty. We don't want to have all these problems with our eyes, our kidneys, our hearts down the road. We want to prevent diabetes right now. So join us, 855-644-3278, or join us on our website. We have a specialist in diabetes. He sees patients every day. He can answer your question. Stay with us on Heart of Health. We're going to be right back after this short break.
Just a moment.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
So here's a question. If you love Jesus, and I mean truly love Him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. We're talking about diabetes and other issues today with Dr. Carlton Vollberg. He owns the Center for Comprehensive Medicine in Chattanooga, Tennessee. We're glad that he's given his time to this ministry tonight. And we lost our last caller, but we have another caller on. Jillian, you're on Heart of Health Live. What's your question for Dr. Vollberg?
Thank you for taking my call. My question is this. My niece was recently diagnosed as a diabetic. She's 11 years old. And her mom was told by someone that if she quit eating dairy products, that would help her to decrease the amount of insulin she required. Now, I know she was also told with her physical activity that would probably decrease it somewhat too. What are your thoughts on that?
Jillian, thank you for your question. The question of the dairy, I'm not really sure about. I don't know that there is a direct link there. That's sort of a new one on me. Maybe there's something that I'm missing in the literature on that. So I don't know that I can comment specifically on that. I don't. In general, my personal views about dairy are that I just think less dairy is probably better. I think that humans weren't made to consume cow's milk and those sorts of products. You can probably find your nutrition and your protein sources from a plant-based diet in a much better fashion. Those are some of my personal biases. I think in general plant-based diets are better. So I think less milk is probably a good thing for most people. I don't know, though, how it relates specifically to type 1 diabetes. Obviously, the exercise and more physical activity is very important for her to do. Unfortunately, type 1 diabetes is not like type 2 diabetes in that once you're a type 1, you're going to carry this probably for the rest of your life. And you can help it, obviously, through dietary choices, but the pathophysiology is just a little bit different than type 2, which is more of a weight-based problem.
Yeah. Jillian, are you still there?
Yes.
You know, there is some people out there, type 1 diabetes, you don't make insulin, and they're from the beta cells in your pancreas, the islets of Langerhans. There's some people out there that say that early in life, when the immune system is developing, that there's certain antigens or chemicals that come into our bodies that the body just is not used to. And there's immune responses that happen in our body that set things off and hurt things.
Inflammation.
So some people think that there are some things that might trigger a genetic predisposition for this. There's a fascinating field, Dr. Vollberg, called epigenetics.
Right.
And certain things turn on certain genes at certain times in the lives. We know about certain things called carcinogens that cause cancer. Well, there's some people say that in type 1 diabetes and others, there might be certain things in the environment that triggers our bad genes to begin with. So, I agree with Dr. Vollberg, Jillian. I would, as much as we can, I would stay away from milk and dairy in young that could trigger these immune type responses.
That's a very, type 1 diabetes is obviously more of an autoimmune type phenomena, just like lupus and rheumatoid arthritis. And there are some peripheral studies out there where people are researchers beginning to see that maybe some of the diets higher in fat, with the meat-based diets, the dairy-based diets that are higher in fat content, that maybe these do turn on some of these problematic genes. And so, again, it gets back to my personal bias. I think a plant-based diet is just a healthier diet all along.
And Jillian, I think sometimes we just don't know.
Right.
Like some people have bad things happen to them, and we can't figure it out. And they say 20% of all diseases are carried in our genes.
Well, you could, for instance, your daughter with the type 1 diabetes, she may have had an infection. You know, very commonly an infection knocks out part of the pancreas that makes the insulin. And so, you know, we see that happening. So there are lots and lots of factors that go into why somebody becomes a type 1 diabetic.
Jillian, thanks for calling. Anything else?
No, thank you.
Well, we appreciate your call. You know, there's so much information out there, Dr. Vollberg, and sometimes it's almost information overload for patients. You know, you got the internet, you got your doctors, everyone has their biases. The drug companies have their biases. So I'm glad that you're here sharing with us. We're not selling a product, we're just giving good information to people.
And I'm happy to be here, and you're absolutely right. You know, I'm not trying to sell a drug. In fact, I'd like to see more patients away from drugs if possible. There are patients that need them, but I'd like to see less drugs used if possible.
Okay, we have some lines open here. Give us a call, 855-644-3278. If you have a diabetic question or any question, we'd love to have you. Or you can go to our website, that's heartwiseministries.org. You're watching Heart of Health Live. We'll be right back after this short break.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're here at Heart of Health Live. I'm Dr. James Marcum with Dr. Carlton Vollberg. We thank you for joining us today. We've been answering your questions live about diabetes. And now we're going to go back to the website and pull up another question for Dr. Vollberg. And this has come into the heartwiseministries.org. And it's, what does the hemoglobin A1C tell a doctor? So tell us, what does hemoglobin, what is it and what does it tell us?
Yeah. Now basically what a hemoglobin A1C is, it's a parameter that doctors use to monitor diabetics, or people they think may be at risk for diabetes. And so basically the recommendation is for every diabetic to get this A1C drawn every 3 months. And it basically tells us how your blood sugar has been over the last 3 months. So people will come in and they'll say, well, I'm not fasting today. Well, it's okay, I can check your A1C today, because it's not looking at today, it's looking at the last 3 months and how your behavior has been, how your diet's been, your nutrition, how well the medical therapy is going, the medications you're taking. Is it actually keeping your A1C in a healthy range. And a healthy range for an A1C is generally speaking less than 6.5 minimum. I like to get mine under 6 if I can.
Okay, so if you have a high hemoglobin A1C, you can pretty much with confidence say you have diabetes?
Yeah, I mean, there are parameters that you can use to diagnose somebody with diabetes. You can have an isolated blood sugar. It's usually over about 126. Or you can have an A1C that's very high, or you can fail a glucose tolerance test. That's another parameter. But if somebody comes in, they've got a very high A1C, chances are pretty good they're going to have diabetes. You can follow up with a glucose tolerance test and confirm it. Oftentimes, I can tell just by looking at the blood work and the A1C that they've got the disease.
And you keep seeing that so many millions and millions of people have type 2 diabetes. What screening test do you look at to sort of help you know whether you want for their testing?
Yeah, so again, just getting back to the basic physical exam, people come in, we look at them, we weigh them, we get their blood pressure, we do a complete exam, we get lab work on them. If their blood sugar comes back and it's a little borderline, I might be inclined, or if they're very heavy, I might be inclined to get the A1C test just to kind of see where it is. For instance, a couple of years ago, I had a patient that came to see me. She's very heavy, overweight. She hadn't been to a doctor in years, which is commonly the problem. And when she came in, her blood sugar was almost 500. Now, ironically, she was 60, close to, I think, 60 years old, so she was not a type 1 as far as we could tell. She was a type 2. But I ended up putting her on a drug called Byetta, which helped her to lose weight. I put her on metformin, and she actually had to go on insulin. So her blood sugar was so high. Remarkably, this person lost so much weight through lifestyle changes and through the medications to some degree that now, I just saw her recently, she was down to just 1 shot of insulin a day. Her A1C was perfect, and I just stopped her insulin.
Oh, wow.
So she lost 60 or 70 pounds. She went from taking Byetta, insulin, metformin to nothing.
To get her over the hump.
Yeah, and we did this over the course of probably 1.5 years or 2 years. Wow. But she learned how to change her lifestyle, and she's off the medications. Wow. And I wouldn't have thought that a year ago.
That's what I tell people. Modern medicine is great for acute problems, but for chronic disease, it's maybe get you over the hump. Sounds like you got this medicine's helped get her over the hump.
It's all about education.
And then she figured out how to do that.
That's right.
But unfortunately, in our world today, they don't want to reimburse for diets. They don't want to reimburse for good education and for follow-up of these things. It just seems like we want to do tests and give pills for all your ills.
I think you're exactly right, and I think doctors and patients are increasingly frustrated by the fact that the doctors are in a hurry to get them in and out because they don't have time. They've got a backlog of patients to see, and they're not getting paid to spend an hour with you. They're getting paid to give you a handful of drugs. It's just backwards. What we need to do is compensate people for education. And until that happens, we're going to have a lot of unhappy people.
Now, you talk about education. You brought some educational products here.
No, I just brought a few things in that we use. We've got actually some free diabetic classes that we offer in our office routinely. But these are just things, just some different, I'll just kind of hold these up for the camera here, just different work guides, study guides, things to help patients as they're navigating through diabetes and other unfortunate disease states that affect that. We have, and I've got a nutrition person that works in the office, but we have, different things talking about food pyramids and so forth. So just some different things. We've got there's all kinds of glucometers out now that are on the market.
And that's to measure your blood sugar.
This is things like this that are around to basically measure blood sugar, and they have memories now that you don't have to write them down. They keep track of it for you. So lots of cool things out there.
And I guess the bottom line is, if you have diabetes, take the time to be educated and learn about it.
Right.
So you can get over the hump just like this patient of Dr. Vollberg's. Listen, we still have time to get some callers in. Give us a call, 855-644-3278. After the break, we're going to talk about different things that diabetes can cause.
We'll return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Nice. No. Come on. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. You still have time to join in our program by calling us at 855-644-3278. We're talking with Dr. Vollberg. He's been teaching us a lot about diabetes. We can't cover all this in a short period of time, but we're going to have him back again. So if you have more questions for him in a later program, go to our website, heartwiseministries.org. He's also a board-certified internal medicine doctor, so we're going to talk about all things internal medicine as well. You can ask those questions too. We just want people to be educated so we can change health one at a time. Dr. Vollberg, and the key to health, it's not going to be legislated. It's got to happen one person at a time.
Right, exactly. I mean, people have to figure out that they have something at stake, that they've got an investment that they're going to make. I mean, when you go and you buy a nice car, you change the oil. If you don't change the oil, you have problems. The same thing with your health. I mean, what's more sacred and dear to you than your own personal health? So when talking about something like diabetes, you want to make sure that you're doing all these things correctly.
You know, and some people will spend more time choosing which store or restaurant they go out than picking their doctor.
Oh, absolutely.
And yet, what's one of your most valuable assets?
Right. You want to find somebody that you feel comfortable talking to, that you can align with, somebody that you can identify with, somebody that's going to be there to help you and not just react. Anymore, you know, people are so busy, and when you go to a doctor's office, you just end up getting a generic prescription for something. And really what we need to do is take some responsibility, both as practitioners and as patients, consumers, to try and get a little bit more than that.
You know, and what I found out is sometimes when you tell the patient the truth, you know, they want a quick fix.
Right.
But sometimes the truth hurts a little bit, but it's important in the long run to say this is what you really need to do. This is how you can not have, the easiest thing is just to give someone a medicine.
Changing bad habits is difficult, as you know. I mean, when you've grown up, you know, and you've grown up with your family farm, and your parents grew up on a farm, and you've learned to eat a certain way, those behaviors are very difficult to change.
Yeah, and that's why at HeartWise we say, you know, it takes that relationship with God that gives you the power to make it one at a time, and it's nice to have doctors that will work with you and nurture you and love you and not judge you. Let's go to another question. Is it true that if my diabetes is untreated, I could go blind? So let's talk about that. If diabetes, what are some complications of high blood sugar?
Yeah. That's a very good question. I mean, we don't see it quite as much anymore. When I was a resident over 20 years ago in the inner city, we would see people coming in with what we call end-stage diabetic complications, where They would come in with horribly high brittle sugars that had gotten so beyond any level of control that they'd be on 4 and 5 drugs, insulin, and so forth. And these patients were developing peripheral vascular disease where the circulation was getting bad. They were losing their limbs. They were on dialysis because they were developing kidney failure. They were losing their eyesight. They were becoming blind. If you think about it, the high blood sugar basically assaults your cells. You know, it assaults the cells in the eyes, the kidneys. It insults the endothelium and your vascular system all throughout your body, the small and the large blood vessels, including your heart. And when this happens, you end up developing microvascular complications, and that you can lose your eyesight, you can lose your kidneys, you can, you know, have a heart attack or a stroke. So, you know, that's the worst case scenario by letting your diabetes go. I don't have very many patients that have those issues. Most of the patients that I have, we've addressed it, and you know, not just because of me, because of awareness now.
Right.
People know to be looking for these things. And so people come in a little bit sooner, they get treated, they get worked up, and we kind of catch it and prevent it sooner. And we get them on medical therapy and get things addressed. But I do have a couple of patients that have let it go to the point where now they're nearly blind or they've actually started losing some limbs. I've got one patient that's got severe eyesight problems because of his diabetes.
Yeah. Well, we had a nephrologist on recently. He said the #1 cause of dialysis or kidney failure in the United States is diabetes.
Yeah, that's absolutely right. And you know, the interesting thing is that what brings people in the most is that they have a family member that was on dialysis and they think, I want you to check my blood sugar. I don't want to end up on dialysis like my grandmother. Or I don't want to lose a limb. Or I don't want to become impotent.
There you go.
So that's another
You know,
complication.
I think that really worked with our males because, you know, the males, that's very something that's dear to their heart, and they say, I don't want that, and what can I do now?
Yeah, it's a great smoking deterrent too, because we know that cigarette smoking actually will kill that part of the body faster than anything. I mean, it's a vascular area, and if you smoke, you end up getting hardening of that artery as well, and you become impotent. Same thing with diabetes and high cholesterol.
Okay, so the answer to that question is yes, diabetes can damage the eyes, it can damage the kidneys, all parts of your body, and you know, it also can lead to impotence and other problems, so we don't want anyone to have diabetes. Well, listen, we still have one section left if you want to give us a call. It's 855-644-3278. We're talking with Dr. Vollberg on Heart of Health Live. Also, you can go to our website, that's heartwiseministries.org. When we come back, we're going to talk about sort of another complication that some people get in diabetes, that is low blood sugar. You know, sometimes medicines can cause the blood sugar to go too low. So stay with us. After the break, we're going to be back talking more about diabetes with Dr. Carlton Vollberg. Stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We have one last question that has to do with low blood sugar for Dr. Carlton Vollberg. And this person writes into our website, I've just been diagnosed with diabetes and a concern my blood sugar might be too low. How can I tell if you're having low blood sugar? Either from a medicine or whatever.
Right. Well, obviously, if you're a diabetic and you're on medical therapy, you need to be monitoring your blood sugar anyway. Even if you're not taking a medication, it'd be wise to at least frequently check your blood sugar to kind of know where you are. And usually what I tell my patients is to get some fasting blood sugar readings. You know, hopefully you're running, you know, between 80 and no more than 120, usually 100 or less. And then if you've eaten a meal, checking it 2 hours after eating, you should be down 135, 140 or less.
Okay.
And so really the only way to know is to monitor your blood sugar. And if you are running low, then that may mean that maybe some of the lifestyle changes you've made are having an impact. Maybe you've lost some weight, maybe the exercise is working, or maybe it is that the medications you're taking are a little too strong.
How might a person feel? What symptoms might they have if their blood sugar is going too low?
Well, you might get shaky. You might break out in a cold sweat. Okay. Maybe have some vision loss, maybe some dizziness, maybe even pass out. So, you know, low blood sugar is nothing to mess around with. A low blood sugar can kill you. So it's something that you want to take seriously.
So if you might be feeling these symptoms or anything not right and you're diabetic, get that blood sugar checked. You know, sometimes a kidney can go bad or a liver can go bad, and that keeps the blood sugar medicine around much longer.
That's right.
And it can make your blood sugar go low. You know, we're all out of time here on Heart of Health Live, but we want to thank you for joining us each week where you are the program with your questions. And we want you to join us each week. You can reach us at our website. It's heartwiseministries.org, or be a Facebook friend. You can join us and be a Facebook friend on Facebook. We want to thank Dr. Vollberg for joining us today on Heart of Health Live. Thank you for joining us, Dr. Vollberg. And we also want to thank our production team, Michael Bell, our director, Gina Graham in the call center, Nick Evanson, who heads our communications. We also want to thank our floor operator, Jake Marcum, and also Kelly, who's been working on graphics. And we want to thank you for watching this program, for learning about your health to prevent the disease that's costing so much and causing so much problems in America. Thanks for joining us on Heart of Health Live. We'll be back next week.